Hello, my name's Newell, and this special report is meant to discuss COVID-19, the disease currently spreading rapidly around the world, and understanding when we've turned the corner, when we've done enough to isolate, to test, to track this disease, and to stop it. My name's Newell. I'm in Urbana, Illinois, a couple hours south of Chicago. Was born in the Motor City. I grew up south of Peculiar. I lived 30 miles north of the Big Apple, what a lot of people call upstate. And I went to high school in New Jersey, so I call a submarine sandwich a hoagie. I'm an emeritus professor of mechanical engineering at the University of Illinois, and I root for Wolverines, Utes, and Illini. Any other information, I'm sure you can Google, but if you're familiar with the 6 degrees of Kevin Bacon, there's no reason why you should have heard of me. It probably takes 10 or 12 degrees to find some linkage. Last fall, when I was in London, I visited the Florence Nightingale Museum. And coincidentally, a special exhibit on the Spanish flu, a little more than 100 years ago to today, was wreaking havoc around the world. Florence Nightingale, who in the 1850s developed modern nursing and sanitation practices along with statistical measures for determining the spread of disease, is an inspiration. Her book, Notes on Nursing, is still a good read and discusses the importance of fresh air, sunlight, and sanitation. To the right is a picture of my great-great-grandfather, John Newell, mayor of Port Huron in the 1860s and a public health officer in the 1880s. Some writings that we've obtained from him at that time indicated that he was dealing with a bout of smallpox, a deadly disease, and all the difficulties in finding the disease, tracking it down, and quarantining the infected. It is reminiscent of what we're having to relearn today. There's a lot of data on the spread of COVID-19, published daily by various sources. I like to use worldometers.info, and that's the basis of this data that I'm showing. The beginnings of COVID-19 started to appear most noticeably in China around mid-January. It started to grow rapidly. The Chinese changed the manner in which they were collecting data, and that's the reason for the jump shown in this plot. But over a period of about a month, the Chinese struggled with gaining control, and then finally were able to reduce the infection rates, to isolate and quarantine people, and are now only just beginning to return back to normalcy. But still, their guard cannot be let down. This stuff reignites at a moment's notice. About a month later, several other countries throughout the world were afflicted. And I show countries with the most infections here. South Korea, which jumped on it early, began extensive testing and tracking and quarantining, and to date have been able to largely keep control of the disease, but again, they cannot let up. Other countries, such as the United States, which we see streaking to the top of infections, we were a little late to the game. We are now trying to make up for lost time, but we are paying for it with the highest infection rate in the world and continuing to grow at a rapid pace. Other countries that we have watched struggle with containing the disease, Italy and Spain, which were hit early on with massive infections, are now starting to turn the corner, but still have quite a battle ahead of them. And France and Germany, which then following Italy and Spain, have been able to somewhat contain and control, but still have a significant struggle ahead of them. And the United Kingdom, similar to the United States, needing a much stronger response, a much more effective method for isolating, containing the spread of this contagion. Iran also, similar to Italy, rampant infection and spread of the disease early on, gaining some control, but now needing to redouble their efforts to reduce the spread of infections as it appears to be growing at a higher rate again. But just looking at this data, it's hard to tell. Have the measures we've been taking effective? Are they effective? And if so, how much more do we need to do in order to get control of it? You'll hear public health officials talk about a basic reproduction number, what's called R0 in the table to the left. And basically R0 is a number that represents one person who's infected walking into a population in which everyone is susceptible, that is, they can catch the disease. And if R0 is 1.4, then typically 1.4 people will become infected because of the person walking into that space. COVID-19 seems to range somewhere between 1.4 to 3.8 in R sub 0. So up to 3.8 people under the conditions that R0 is defined might get infected by a single individual. This compares to a range of 2 to 3 for the Spanish flu, and although they are very different diseases, the spread rate is somewhat similar. Ebola, which, while not a respiratory or an airborne-based disease, spread primarily through body fluids, that it has a similar but somewhat lower reproductive number. Middle East respiratory syndrome has an R0 less than 1. And whenever R0 is less than 1, this indicates that the disease is not self-sustaining. It doesn't infect enough people to keep it growing throughout the world. But even though this has such a small R0, it's possible to create an environment within a building that's poorly ventilated, that's not cleaned properly, such that the local reproduction number can be much greater than 1. And because of the deadly nature of MERS, it's something to always be aware of and to keep our eye on. We see that measles and smallpox, what my great-great-grandfather had to deal with in his day, but now we consider eradicated, these had reproduction numbers that were very high. So high, in fact, that the graph on the right, which shows without substantial change in the way we do things, the way we go about our living, that anything with an R sub 0 that's greater than 5 is likely to infect everyone on the planet or everyone susceptible within a community. When reproduction numbers are in the range of 2 to 3, such as for COVID-19, we'd expect that maybe 40 to 70% of the populace, without changing the way we live, will become infected. Now, 40 to 70%, 50 to 70% within the United States, that means maybe 160 million to 225 million infections. And while many of those may not be significant or deadly, just a 1% mortality rate of this would mean 1.6 to 2.25 million deaths, something we haven't seen from any disaster in a very, very long time. We are in hopes, and the numbers that we are currently hearing about indicate that if we are responsible individually and collectively at restricting our movements, at isolating and distancing ourselves, that maybe we can move this down to a much lower reproduction number, a reproduction number in which maybe only 10% of the US population would be infected. But still, 32 million infections with a 1% mortality would be 300,000 or so deaths. a number that's just hard to imagine. So I've put together a parameter that I hope helps understand how we're doing, and day by day allows us to look at the status of the steps we've taken, and following that in the countries that, at least to this point, have had the highest rates of infection. This parameter, basically an infections per infection parameter, not the reproduction number we were just discussing, but one that ideally, when we get the number down to 1, indicates that the infection is not continuing to be transmitted. And when the number is greater than 1, that we need to take steps to try to figure out pathways to reducing it. So how are each of these countries doing relative to each other? This plot is just the same plot I showed before, but with some projections made. Projections for the US with 3 different choices based on how effective we are at isolating ourselves, and then a projection for South Korea if it's just able to maintain what it's currently doing. Now, what you'll notice with this plot, though, is it's a logarithmic plot. Over to the left, everything increases by a factor of 10, rather than the linear scale of the initial plot. When we look at the United States, I have plotted the US with a number 7, a number 2, and a 1.5. And these are the infections per infection parameter I was describing. And basically, the interpretation of it is that when this value is 7, which is the current path that the US is on, this indicates that one person over a period of about 14 days of being infected and shedding the virus and potentially infecting others. When we're at a level of 7, that's indicating that that one person over 14 days would be infecting 7 people. Basically, one person every other day is infected because of this person having contact with them. If we're able to knock this parameter down to 2, that is over a 14-day period of someone who's sick being able to infect 2 other people during that time period, then we would have a slower growth rate as indicated by the blue line. And if we're able to further reduce it to 1.5, then we could lower it even more. Now, the difference between this infection per infection rate of 7 and getting the infections per infection parameter down to 1.5, this is almost 10 million different in infections, and 10 million less people infected in the US or wherever in the world results in many, many less fatalities. When we look at South Korea, which currently has an infections per infection parameter of about 2, so a much, much slower growth rate, and because they established effective control procedures early on, with this level of infectious growth, they are on a path that's going to keep them somewhere around 10,000 or so infections. Now, it could reignite at any time. They could lose control in some manner due to a large gathering of people or some other manner in which people are able to communicate and to efficiently spread the disease. But hopefully they can stay on top of it and then start to totally eliminate the migration and propagation of this disease. This table is a table I'm going to put up every day. So starting tomorrow, I'll update this table and show over the past week. But this is this parameter of infections per infected spread over a 14-day period. And while it may not be the manner in which an epidemiologist or a public health official may model this, It has all the characteristics of the type of models that are being used. And so when we look at this parameter, how many people might be getting sick because of one person infected for a period of about 14 days, we see South Korea has been hovering around 2 over the last week. Italy has been about 3, but has been making good progress getting down to a level similar to South Korea, but with a much higher load of infections. They still have a lot of work to do to get this below 2 and to a level where hopefully it's within the capabilities of their medical system without straining their resources, straining their medical personnel as they've been experiencing. Spain, which is a bit earlier than Italy in this fight against COVID-19, has been making steady progress. They have quite a ways to go to get from an infections per infected parameter of 4, getting it down to 2, but their progress has been steady over the past week and hopefully will continue to decline. France and Germany are quite similar. They were able to keep the extremely high growth rates that were experienced in Italy and Spain a few weeks prior, but still experiencing very high levels of growth rate, but now being able to move down toward this parameter level of 2. And I think that any country, once they can reach an infections per infected parameter of about 2, and then ideally keep knocking it down below 2, that they're at a level where hopefully their medical personnel, their medical staff, their medical supplies aren't being strained to where very difficult choices are being made for those who are severely afflicted. Iran has a similar path as what Italy has taken, but is at somewhat of a higher infection rate. And so they've continued on a growth path. You can see that it looks like for a couple of days that the growth was increasing, and now they're starting to get it back down and hopefully can continue that trend. And then the United States and the United Kingdom. If you go a few days before this week, you would have found that before we started implementing effective controls, we were seeing as many as 50 to 100 infections per infected over a 2-week period. So we've made great progress from that when it was freely running rampant through our populace, but we still have a long ways to go. While we've knocked this down to a level of about 6 or 7 infections per infected, we still have a very difficult struggle. And what this means is that each of us individually, collectively, needs to isolate. We need to avoid getting in contact with others if we suspect we are sick. Ideally, if each of us were able to isolate perfectly for 2 weeks, 2 to 3 weeks, this could not be spread. It could not be passed on to another person. It would die out with our recovery, and then we could emerge from that. But knowing that we cannot perfectly isolate ourselves, especially our brave medical personnel who are on the front lines and those in other essential businesses, from our food chain to other essential services, that it's just not possible to have perfect isolation. But the rest of us who are not so essential, it's critical, it's essential that we take this seriously, that we avoid getting in contact with others, because there's such a latency period in this when you don't know that you're infected, but when you may be shedding virus and infecting others, that we take this very, very seriously. So I'm planning to update this every day. I'll show a new bar graph. It won't be quite so long as this one is just meant to be an introductory discussion. But I hope that this will give us a metric so that day by day we can see among these different countries how well we're doing. We can cheer each other on, and hopefully together we can put this thing down and win. I'll leave you with this final note. Uh, Professor Aldo Leopold, a professor in the 1930s, who was very concerned with leaving a better world for those, as you see, my young granddaughter here and my wife. It's very important to leave a better world than the one we were given, and for each successive generation to do that. We have this massive challenge against us. We'll get beyond this. And then, in Aldo Leopold's word, let's figure out how to live on a piece of land without spoiling it and make this a wonderful world for future generations for many, many years. Thank you. Goodbye.